All right, let's talk about men getting the good old snip snip, shall we?
Since having our fifth baby, everybody wants to know what we'll be doing for birth control, like it's anyone's business. I'll tell you what we won't be doing is a vasectomy. Not because it's inherently bad, but because there are still so many unknowns. Over 500,000 men get vasectomies every single year in the United States. It's one of the most common elective procedures performed worldwide. But what do we actually know about what happens to the male body 30 or 40 years later down the line? A vasectomy doesn't stop sperm production. The testicles continue to make sperm for the rest of a man's life. The procedure blocks the transport pathway so sperm can't enter the semen. Semen is still produced, it just doesn't exit. Instead, the body breaks it down and then reabsorbs it. And in 60 to 70% of men, the immune system forms anti-sperm antibodies after the procedure. So we know the immune system recognizes that change. But what we don't fully understand is what that immune activation means over time. We do have certain observational studies following men for 20 plus years. One tissue study examined men nearly 40 years after a vasectomy and did not find any catastrophic structural damage. Large cohort studies have not consistently shown increases in cardiovascular disease or overall mortality, and that's important. But observational studies are not the same as long-term mechanistic randomized trials. In 2007, researchers at Northwestern University published a small study suggesting a possible association between vasectomies and a rare form of dementia called primary progressive aphasia. That study was small and preliminary, but it did raise a question about whether immune changes after a vasectomy could have neurological implications later on. And that question has never been fully answered. For a procedure performed over 500,000 times per year in the United States alone, we still don't have large randomized trials following men over long periods of time, deep mapping of chronic inflammatory markers over decades, strong long-term cognitive outcome data, research on how lifelong sperm reabsorption affects male aging biology, or subgroup analysis in men with autoimmune susceptibility. That is a surprisingly thin evidence base for a procedure so common. We often talk about how monthly ovulation plays a long-term protective role in female biology, but we don't talk about the role that regular sperm elimination has on men's physiological health. Is there a long-term impact of retaining and reabsorbing sperm for 30 or 40 years? We don't have strong data answering that. I'm not here to tell you what to do. Many men undergo vasectomies without obvious long-term complications, but as a provider and as a wife, it's my job to raise challenging questions because informed consent should include what we know and what we don't know. Unknown risk is still risk.